Hi, my name is Megan Davis, and I am the newly hired Director of Performance Improvement at the Brownville Memorial Hospital. In order to improve the hospital's patient and family ratings, I have developed a long term staff health education program that will focus on health literacy. This program consists of a workshop for all existing and new staff over the next 2 months. During the workshop, we will be focusing on two areas of concern. With that being said, let's get started. So, the first key area of concern is addressing language and cultural differences. The first amongst families and patients. This is an important key area of concern for several reasons. Number one, to address the health needs for populations who speak limited English or for those with various cultures, to create a better understanding of how to access adequate health services, understanding medical technology and terminology, and to make informed decisions on their health or for their loved ones. Culture, linguistics, and religion plays a huge role in how people understand and make sense of health information. To prevent diseases and to promote optimal health for all. And last but not least, it is important for health providers to communicate accordingly to address any concerns or questions the patient may have. So now the following are the issues for this particular key area of concern. First issue is that it can create confusion for limited English-speaking patients, causing inaccurate understanding of health information. Can contribute to poor health outcomes through misunderstanding, value conflicts, and disparate concepts of health and illness. And last but not least, can cause medical errors, medical instruction errors, and can cause negative outcomes of care at both the individual and population level. So now here are two pictures that illustrate this issue. The first picture is the wife explaining to her husband of his medical records as the provider should have effectively communicated to her prior leaving to the hospital. The second is a patient who is clearly confused by the health information that is being communicated to her. All right, now moving on to the second key area of concern for the workshop, which is to encourage patients to ask questions. This is an important key area of concern for the following reasons. Number one, it helps patients learn new information about their health, confirms that the patient understands key concepts, information, and results, opens a discussion for many and any concerns from a patient point of view, provides a sense of ease for the patient and provider, provides a strong relationship between the patient and provider. Now, the following are issues for this key area of concern. Patients often find asking questions to be difficult regardless of education or demographics. Common feelings of embarrassment, fear, intimidation, or overwhelm can occur in patients. And last but not least, patients must be fluent in medical vocabulary, understand basic biology, and have enough confidence to speak up to respected health professionals. All right, so now here are two other pictures that illustrate this particular issue. The first picture shows the patient asking adequate questions in regards to her health data that is being presented to her. The second is a patient who leaves the hospital with many unanswered questions due to feelings of intimidation during his visit to his medical provider. Now moving on to some communication principles. The CDC and the DHHS created a health literacy campaign in 2009, whose purpose was to improve health literacy for older adults. According to the published expert panel report, minimal health literacy has been linked to increased health disparities, poor health outcomes, unnecessary healthcare services, and medical and medication errors. The key communication principles needed to employ in order to address this issue include understanding the audience, understanding the problem, anticipate objections, communicate a little at a time, present information in several ways, and develop a practical, useful way to receive feedback from patients. The methods that are aligned to these particular issues include enhancing literary skills from patients with various backgrounds and cultures through collaboration of health professionals that discuss suggestions to deliver and create more accessible and appropriate health information for older adults. With that being said, older and limited speaking adults possess the inability to convey health information to formulate decisions regarding their health. Poor health literacy associated with poor oral or written English skills affects the patient's ability to navigate the healthcare system. and suggestions to address this issue continues to be a prominent priority on a national level. So a couple recommended best practices. When providers communicate with patients, complex language should be avoided at all times, especially for ESL patients. Plain language should always be incorporated during these interactions. A few recommendations that I have in order to improve health literacy include acknowledging cultural differences, having at least one highly experienced medically trained interpreter at the hospital at all times to communicate health information from the provider to patient, supplement instructions with pictures or posters that can be visibly displayed for the patient, ask open-ended questions so that the patient has the opportunity to ask their own, utilize the teach-back technique to enhance communication, evaluate patients' understanding before, during, and after introducing new health information or services, and the most obvious, limit the number of messages, use plain language, and focus on action. All right, so a brief exercise intended for workshop participants to implement in groups of 3 to 4 individuals will be focused around language and cultural differences. It is each group's responsibility to research a region of the world, 7 continents total, and provide information to the rest of the groups of that continent's language, cultural practices, stereotypes, religion, health beliefs and customs, dietary customs, communication, and patient expectations. Details for the small group exercise include brainstorming solutions on how to combat these differences and to increase patient sensitivity. Daily group meetings will be during 9 a.m. and 12 p.m. every day in order to discuss and research. And finally, there will be a group presentation at the end of the week to learn about each group's continent and the language and cultural differences that we need to be aware of. Employees will then combine all the information in order to create a section in the handbook for employees and new employees to come. Time frame to complete the small group exercise is 1 week in order to research and develop solutions for each group per continent. Alrighty. Now, the materials needed to complete the exercise include a notebook, pen, reliable internet connection, and access to Wi-Fi, easy access to portable laptop, PowerPoint, in order to present to other groups, and handbook drafts. The purpose of this exercise include to understand and inform employees of a variety of culture and language difference, to improve cross-cultural communication skills, to learn how to avoid stereotypes about health beliefs and cultural practices, to develop expertise in specific groups who share the same cultural backgrounds, and last but not least, to create solutions to increase effective communication with all patients to deliver quality healthcare and to prevent potential errors or wrong decisions. Thank you for your time. I am looking forward to conducting this workshop for the employees at Brownville Medical Hospital to improve health literacy for all patients and to develop stronger connections between patients and providers.